Hi, I'm Jamie Smith, your cancer control specialist with the Kentucky Cancer Program. Today we're here to talk about tobacco. Our topic today is one that impacts the health of many Kentuckians, and our guest speaker today is the national expert. Newly released statistics show that nationwide there is a steady decline in the diagnosis of cancer as well as in deaths. However, Kentucky still leads the nation in cancer death rates primarily because of its high lung cancer burden. In addition, Kentucky is home to the nation's highest percentage of smokers at 28% of adults. Tobacco use remains the single largest preventable cause of disease and premature death in the U.S. Our guest today is Dr. Richard Hurt, and he is an internationally recognized expert on tobacco and nicotine dependence. He is the founder and director of the Mayo Clinic Nicotine Dependence Center in Rochester, Minnesota, but interestingly enough, he's also a native of here in Murray. So Dr. Hurt, how did one from Murray find his way to the Mayo Clinic?
Well, it's kind of a long route. I ended up going to medical school at the University of Louisville, and then did my internship in Memphis, and I got to know some people who had been to Mayo Clinic before, and ended up doing my residency there. I was planning to go there for just 3 years and then come back to Memphis to practice, but that was over 30 years ago, so it's a long 3 years. I've been there ever since. It's been a really good ride.
Good, good. Well, we are very excited to have you here, and interesting to find out some knowledge from you about tobacco. In Kentucky, we face some questions every day about tobacco and smoking in the news. It's in the media, it seems like every day. And there's one question that people are asking: is there really science to support the fact that tobacco does cause chronic disease such as cancer? What information can you share with us on that?
Well, that question comes up a lot, and I think it comes up because of the cigarette industry for the last 50 years has been adopting a strategy to create doubt about the science, and they've been very good at that. They've done a very good job about that. The science is absolutely compelling that cigarette smoking causes heart disease, emphysema, various cancers, lung cancer, esophageal cancer, pancreatic cancer, cancer of the kidney, cancer of the bladder. The science is just overwhelming. There is absolutely no doubt that cigarette smoking causes all of those things, plus a myriad of other things. And even the exposure to secondhand smoke causes a large number of problems as well. What we know about this is that there's a dose response, which means that the heavier the person smokes, the more exposure they have, the worse the outcome is as far as diseases are concerned. And in our country, in the whole country, about 430,000 smokers die every year of a tobacco-caused disease. And for every 8 smokers who dies of a tobacco-caused disease, one innocent bystander, often a child, dies from secondhand smoke exposure. It's a pretty remarkable statistic. And if you wanted to know what that looks like in terms of how many people we're talking about, 450,000 or so people, it's the equivalent of 3 fully loaded 747s crashing every day, 365 days a year with no survivors. That's how many people we're talking about.
And that would definitely make the headlines.
Well, I would submit to you and your viewers that if you had 2 747s to crash in the same day, the next day all the 747s would be grounded.
Right, right. That's pretty powerful and can help put that into perspective for so many people, because sometimes we just don't think of that.
Well, and the other thing most people don't realize is that cigarettes were not part of our society as a product until after the turn of the 20th century. The first rolling machine for cigarettes was not invented, automated rolling machine was not invented until 1883. And so it wasn't until the 20th century that Americans began to smoke cigarettes very frequently. And just within a short few decades, we went from smoking 4 billion cigarettes a year to smoking over 600 billion cigarettes per year. And what that's unleashed is a set of diseases that were unknown before the 20th century, such as lung cancer, emphysema, and this epidemic that we have with heart disease. So there are many diseases caused by cigarette smoking, but probably the prototype, and the easiest one to understand, is lung cancer and emphysema, because they were basically non-existent diseases 100 years ago.
Okay. What about the chewless, the tobacco that they have out now, and that seems to be pretty big among children, or the younger kids in school. What is that causing the effects of? Is that the oral cancers we see? Or
Correct. And I would have to be the first to say that if you look at the two products, cigarettes on the one hand versus chewing tobacco, or we call it, Joe Garagiola calls it spit tobacco. Now, you don't know who Joe Garagiola is, but Joe Garagiola used to be a catcher for the St. Louis Cardinals, and he went on to be on the Today Show. And so he's very concerned about Major League Baseball players using smokeless tobacco. He prefers to call it spit tobacco because he says just because it's called smokeless does not mean it's harmless. But on a grading scale, cigarettes cause more problems than chewing tobacco does, but chewing tobacco causes all kinds of problems in the mouth as far as oral cancer, teeth loss, and a myriad of other things. But there's new evidence now that chewing tobacco also has an effect on the heart, causing heart disease, as well as other cancers. So we're, one in particular, the association between chewing tobacco and pancreatic cancer. So we're learning more about that as we go along. But the one thing that chewing tobacco will cause is addiction to tobacco, and we know that very clearly.
Okay. Well, let's talk a little bit about that addiction. What is it that's actually in a cigarette or in tobacco that causes that dependence in a smoker?
Well, it is the nicotine. So the nicotine in tobacco products is packaged in a form that is very addicting. In other words, when you have like a nicotine patch or nicotine gum, that's in a form that's we call it medicinal nicotine. It's very safe, and it helps people to stop using. But in cigarettes, the cigarette companies many years ago figured out that if you added ammonia to the tobacco, then you could increase the concentration of free nicotine. Ammonia is a base, unlike an acid like battery acid. Ammonia is a base, and therefore when you add ammonia to the tobacco, it freebases the nicotine. And in fact, the secret of the Marlboro cigarette was adding ammonia to the tobacco to freebase the nicotine. Everyone's heard of freebasing cocaine, but Marlboro was freebasing nicotine before the drug culture knew how to freebase cocaine. So the speed of delivery of any drug has to do with its addictive potential, and cigarettes are the most efficient delivery form of nicotine that exists. It gets the nicotine to the brain basically within 5 heartbeats. It goes from here to there. And what we know about all this is that the receptors in the brain that are responsive to nicotine really get an effect from those very high concentrations of nicotine delivered by cigarettes. Chewing tobacco, on the other hand, or spit tobacco, causes the absorption of very large quantities of nicotine, but it's more slow over time. Cigarettes cause a spike, and chewing tobacco causes it. But if you look at the total amount of nicotine exposure during a day, a person using chewing tobacco or snuff is basically the same as a cigarette smoker.
And what about cigar smokers? If they're smoking a couple cigars a day, that's the equivalent of, could be equivalent of a pack of cigarettes within a couple cigars.
Cigars and pipes are really different in that they already have a very high pH in the tobacco. The tobacco of cigars and pipes has a pH of 8, which means that half of the nicotine in those products is in the free form. So you don't even have to inhale that to get a large amount of nicotine into the system. And cigars, you know how big they are, you're right, they can be the equivalent of many cigarettes all wrapped up in one product. And one of the worst things for people to do is if you stop smoking to switch to another tobacco product, especially going from cigarettes to pipes or cigars, because cigarette smokers end up inhaling those products just like they used to do cigarettes. And therefore you not only get higher concentrations of nicotine, but you get even more dense smoke from cigars and pipes than you do from cigarettes. So it's even worse.
I know that you were a smoker before in the past as well. You've talked about that. So what was it for you as a smoker that got you started smoking, and what really made you become addicted to it? Was it just because it was a social habit or just something to do, or?
Well, I think people have to understand that there are different types of people as far as their responsiveness to cigarette smoke. For example, all of you probably heard of a person who experimented with smoking and tried to smoke, but nothing ever happened. They didn't get a buzz from it, and so they just said, what's the point? On the other hand, people like me who smoked a little bit in response basically to the social pressures of the day, because back when I started smoking, half of adult men were smokers. I thought everyone smoked, but it was only half of us. So when I started smoking, it was because of that, because of the social influences. But once I found out what this did to my brain, then I became an addicted smoker almost from the very beginning. So there are people who have experimented that didn't become smokers, people like me who became addicted very quickly. There are others that smoke for a while over time and become addicted, and so their brain reacts even different. And then there are people that drive everyone crazy, the people who can smoke socially, smoke a few cigarettes on an occasion and not have another one for a while. And if you measure the amount of nicotine they get from the cigarette in their circulation, it's very similar to what a smoker gets. But for whatever reason, the genetics of this are such that they just do not respond in the same way. So there are different, what we call genotypes, different genetic makeup of people in their response to nicotine. And for people like me, I just became addicted very quickly.
And what about secondhand smoke? We know that you're also an expert on the secondhand smoke and the effects that it has on a non-smoker. For someone to be in a room with a smoker, how harmful is that to the non-smoker in that room?
This is probably one of the least well understood by the public issues, and there is no safe level of exposure to secondhand smoke that exists. The Surgeon General's report of 2006 basically said that there's no lower level of exposure that is safe for human exposure. And just to give you an idea, the inner lining of the arteries is called the endothelium, and the inner lining of the arteries allows the artery to dilate and to contract, so that if you have to run someplace and your blood pressure goes up, your aorta then can dilate because your blood pressure goes up, and so it can accommodate for that. And what happens when you have exposure to secondhand smoke, even for 5 minutes, it stiffens up the lining of the aorta so it cannot expand, and therefore can cause little cracks in the lining of the aorta, which is the beginning of hardening of the arteries, or atherosclerosis. So 5 minutes of exposure will reduce the ability of the aorta, which is the main blood vessel coming out of the heart. It reduces it by over 20% as far as its ability to dilate. 30 minutes of exposure causes a decrease in the ability of the coronary arteries, the heart arteries, to respond to the need to have more circulation. So though we know that secondhand smoke causes a myriad of diseases, including lung cancer and heart disease, it also causes very immediate effects in people who are exposed, even for short amounts of time.
So even if you go to a restaurant and you're sitting in a non-smoking section, if the smoking section's right beside you, then you're still going to get some of that smoke.
And what we know about that is that cigarette smoke is a set of particles, and the particles contain over 4,000 chemicals. They contain over 60 known cancer-causing chemicals. And when you have smoke in particle form, it obeys all the laws of physics. So if you had a cigarette lit on this corner of the room, then pretty soon it would be over to that side of the room. The smoke goes all through the air. And you can't have ventilation systems that get it out of the air because the smoke particles are very energized. So having separate sections in a restaurant is not very effective at all as far as reducing your exposure. In fact, the analogy we use is if you had a swimming pool and you had a sign on one end saying, "No peeing allowed on this end, but you can pee on that end," that's the same analogy.
Right.
So that it just all it goes through the entire space.
It'll mix together. Okay. Well, we're going to take just a short break, and then when we come back, we'll kind of talk about maybe the smokers that want to quit smoking and what your advice is to them on that.
That'd be great.
Thank you. Welcome back. Dr. Hart, we'd like to take just a few minutes and talk about, in November, of course, the American Cancer Society has the Great American Smoke Out, which is a day some people may use as a quitting point for smoking. And then, of course, New Year's is right around the corner as well, and those are sometimes resolutions people start out with. So what is your best advice for someone that maybe wants to quit smoking?
Well, first of all, I'd like to give a little plug for Minnesota, because the first Great American Smoke Out occurred in Monticello, Minnesota, and that's where the idea originated. The editor of the newspaper there wanted to have the whole community try to stop smoking all at the same time, so that's where it actually came from.
Well, that's neat.
So it is kind of neat. And it's important to set a date to stop smoking. In fact, that's one of the first things a person should do. Stopping smoking is a process. It doesn't just happen all at one time. It's something that people have to work at over time. And so just because a person has tried to stop smoking before and wasn't able to do it then doesn't mean that they can't do it this time. And in fact, if they've had any previous success, they need to build on that success and learn from what they had learned from before. So setting a date, and the Great American Smokeout's a great time because a lot of other people will be trying to do the same thing. So setting a date within a month from now, which it would be, and then begin to prepare for that by changing your behavior, changing the things you do, maybe exercising more, changing the way that you eat, eating healthier, just changing the things that would normally be associated with smoking so that once you get to that date, then you're prepared for that. And the healthcare providers can help with this too. We know that counseling and any type of support from a healthcare provider is very important. And medications help too. We have more medications now than ever before to help people to stop smoking. There are 5 nicotine replacement products, there are 2 non-nicotine products, and all of them work and all of them are very safe. All of them basically double your chances of stopping smoking. If you're a heavier smoker, then it may require more than one medication, may require more than one nicotine patch. So you need to talk to your healthcare provider about that. And there's good information about that available in a lot of different places.
So would you advise a person that was a smoker just to go out and start buying stuff over the counter, or should it be something that they do discuss with their physician first?
I think actually it's better to talk with their physician because there may be other health issues, but the physician usually can help with this as well. And they may need to, there are some things that are available over the counter, but there are also some things that are only available by prescription. And so some of the things that are available by prescription probably can augment and affect these things even better.
Okay. And now some of the prescriptions that are available, are they to be taken with over the counter as well?
They can be, and that's where the physician or healthcare provider advice helps, because we frequently will use nicotine patches along with a nicotine inhaler or bupropion, which is also called Zyban, along with nicotine patches. And so that's where the healthcare provider can help with that.
Okay. All right. Well, what would be the one thing that you could do or that we could do as a community to stop our children from smoking today so that they never start?
Well, there are 2 things that the cigarette manufacturers hate more than all the rest as far as public health policies are concerned. One is increasing the prices, increasing the tax on cigarettes. The other is having smoke-free workplaces. Those 2 public health policies do 3 things. They reduce the consumption of cigarettes by a person who continues to smoke on average of 3 to 5 cigarettes per day. They increase the chances of a person who wants to stop smoking to actually stop smoking, and they decrease the chances of a young person ever starting. So from a public health policy standpoint, those are the 2 most important things that we as a community or a state or a nation could do in order to help our young people from ever starting. There are other things that can be done. I mean, school-based programs are helpful. The advertising and promotion is, the tobacco industry spends $15 billion with a B dollars per year promoting their products. And it's little wonder that the most popular products with young people are the ones that are most heavily promoted. So if you have an African-American young person who starts smoking, they invariably start smoking Newport or Kool because those are the ones that are most heavily promoted in the African-American community. If you're a Caucasian, the 2 most heavily promoted brands are Camels and Marlboro. So little wonder that young people start smoking Camel. They don't go out and smoke a generic cigarette. They smoke the ones that are branded because those are the ones that are most popular and most heavily promoted. So if we could ever do something about the way that they promote their product, that'd be fine. But that's not likely to happen in my lifetime.
Right. Something interesting is that in Kentucky we spend $1.5 billion annually on the costs associated with tobacco-related illnesses. And you just spoke briefly about workplace, smoke-free workplaces, and we have some of the communities going smoke-free. If we had more and more communities, of course, do this, how great of an impact would that have on the annual expenditures of the state?
I don't know how to calculate that exactly, but what we do know is that, like in Fayette County in Lexington, when they went smoke-free as a county, within a space of about 2 years, their smoking rate in their county went from about 27% down to 17%. it was one of the most effective things they've ever done to reduce their smoking rate. And what we know is if you reduce the smoking rate, you eventually will reduce the healthcare cost, all the costs to the ventilation systems, and just think about it. If you got a product that produces basically a cloud of particles that contain over 4,000 chemicals, arsenic, benzene, formaldehyde, acetaldehyde. If that lands on your keyboard, guess what? Your keyboard or your computer is going to wear out faster. Everything wears out faster with exposure to secondhand smoke. So just from a business expense standpoint, not even to begin to think about the healthcare risk, it is a positive for everyone when we have smoke-free workplaces.
Okay. Thank you so much for that. That's would certainly help many communities today, and that's interesting to hear about the statistics there in Lexington. That it's just astonishing to see those.
If they can do this in Lexington, Kentucky, it's amazing. When I go travel around other places, I point to Lexington as really their Metro Council passed that ordinance 11-3. Took a lot of political courage to do that in the middle of Burley, Kentucky, basically. But they did it, and they did it for the right reasons, because the science is very clear. The secondhand smoke kills people, and having smoke-free workplace policies reduces the prevalence of smoking, decreases the chances of a young person ever starting, and helps people to stop smoking. I mean, that's pretty good any way you slice it.
Well, I'd like to go back and just talk briefly about the people that are thinking about quitting smoking. And when we talk about the nicotine replacement that they can use, but also maybe different support groups or what's actually available out there. You talked about behavioral changes, and I thought it was interesting too. You said stuff about exercising and changing the way you eat. Why would that be important for that smoker to quit smoking?
Well, a lot of people don't understand that exercise itself is good for several reasons. One, it just is better for you as far as your overall health is concerned. But for women in particular who are concerned about gaining weight when they stop smoking, beginning to do regular exercise, and it doesn't take a lot, 30 minutes a day of moderate exercise not only helps with weight control, but also helps with reducing cravings and urges to smoke and withdrawal symptoms. And so instead of sitting in the chair when you're having an urge to smoke and having a cinnamon roll or something or other, get up out of the chair and walk down the block or walk down the road and just do a little bit of exercise. And that does two things. One, it keeps you from eating that, but also relieves some of the withdrawal symptoms. So changing those basic behaviors that are associated with smoking is very important. Now, there's some things you can't change, but you need to identify those things where you're at risk. I didn't think my car would start until I had my cigarette lit. So the routine was get in the car, push in the lighter, get the cigarette out, put the key in the ignition, lighter pops out, light the cigarette, turn the key. And I was amazed that the car would start without me lighting a cigarette. So there's some things that are just automatic, and you need to learn what those are and begin to dissociate yourself from them.
Okay. So basically it's a habit that you've started, and just depending on how long you've been a smoker, and that's the habit that you're trying to change, and the behavioral changes help break that habit.
The behavioral changes do help to work on that, but the addiction part of it is really very powerful. So we've had people who have stopped smoking for many months, and then they get themselves in a situation, maybe had a few drinks, or are under stress, or having an argument, and the first thing they reach for is a cigarette in order to cope with that. So you need to have a plan. Once you've stopped smoking, you need to have a plan for those situations when they arise, because they're going to. You're not going to go through a life without any stress in it. So you have to have a plan to what am I going to do when that happens. And so that part of this behavior change is planning how you're going to cope with those things.
And what about support groups? How can those benefit a smoker as they're trying to quit?
Anytime you have another person to help you, whether it be a healthcare professional or a support group, there are nicotine anonymous groups that are around, or even just groups within hospitals and medical settings where you can go as a group together to talk about this. That's very helpful. Having that support is very, very helpful. And it can be from a family member as well, but if you have some professionals that can help with that, that's even better, yeah.
That's good. That's good advice. And there are several different support groups that are available in our communities here to help people. So that's maybe something that some people may want to look into.
And no one should be afraid to ask for some help. I mean, there's always this idea that, Uncle Charlie smoked 2 packs of cigarettes a day for 30 years and one day just threw the cigarettes away. So I can't stop smoking. And Uncle Charlie was a reprobate. You know, he was just a no good, and he was able to stop smoking all on his own without any trouble. So if I can't stop smoking, there must be something wrong with me. Well, unfortunately, there are Uncle Charlies out there that can do that, but most of us became addicted to cigarettes, and we have a much different genetic makeup than Uncle Charlie did. And so if we need help, get the help, and there's more help now than ever before.
So don't get frustrated if you can't quit the first time. You can try again.
You should try again.
Okay.
I stopped smoking dozens of times, sometimes for as long as 30 minutes, sometimes for as long as a week. And it's a process. It takes a lot of energy and a lot of effort to it. But once you do it, then maintaining that abstinence from smoking is really critical. And the longer you go, the better it gets.
So did you truly lose the addiction for the nicotine? You don't crave a cigarette anymore?
No, I haven't craved a cigarette for, well, some people do for many, many months or even years, but that gets better. The cravings can be very intense, but they're very short, usually lasting 2 to 3 minutes. And as you go along, after you stop smoking, they become less intense and the distance between them gets longer. But they can be provoked by anything that you used to would associate with smoking. I used to, when I'd go in to buy cigarettes at the convenience store, I'm so tall, they always had those things hanging over.
Yeah.
And so I would have to look underneath to pay my bill, and I'd bump my head, and that was always a reminder that, you know, there's Marlboro up there if you just wanted one. So I tell people, if you find yourself at a convenience store and you've got your milk on the counter and your thought was, maybe I'll just get a pack, I'll just have one, leave the milk, leave the bread, leave the store. Have a plan to escape from those points where you would normally have done that.
Well, I think that's very great advice, and we just want to say thank you for coming today and sharing your wisdom with us. It's been definitely interesting for me to speak with you and to learn more about tobacco and the harms of not only smoking but secondhand smoke, and then also the nicotine replacement and how someone can go about quitting.
That's especially for someone in your condition of being pregnant. Being around secondhand smoke is not only bad for you, but it's bad for your baby as well.
Right. That's definitely true, and that's something that I've been more noticing since I became pregnant. I'm more protective of myself.
You should be.
So, well, thanks again for coming today. And if anybody has any questions on today's show or wants some more information, please contact our office, the Kentucky Cancer Program, at 270-442-1310. Thanks for joining us today, and we hope that you all enjoyed the segment today. Thank you.